What is high blood pressure? If you've clicked on this video, then you're probably curious about what high blood pressure is. High blood pressure, also known as hypertension, is when your blood pressure is consistently high. And the reason why we're worried about this is because it means that over time, the heart is having to work extra hard to pump blood around the body, and that can lead to damage and therefore cause other conditions such as heart attacks, strokes, the heart failing, and also dementia, to mention the least. Hello everyone, my name is Dr. Uyiosa, and this channel is on all things health, business and finance. My goal is for us to get healthier together whilst making better money and business decisions. How do you know if you have high blood pressure? Well, the issue with high blood pressure is most of the time it doesn't carry any symptoms unless it becomes something known as malignant hypertension, and in those instances an individual may experience headaches, blurry vision, etc. But we'll cover that in a different video. Now, because the majority of high blood pressure does not have symptoms, it's super important that you get your blood pressure checked regularly so you can monitor any changes to it. There are two ways that you can get your blood pressure measured. The first is a manual method, and it actually involves a stethoscope like the one that I'm wearing at the moment. And the second method is automatic, and I have a feeling that the second method is probably the most common in the UK if you've ever visited a GP surgery. When getting your blood pressure checked, there are two numbers that you need to be aware of. The first number is usually the bigger number, and it's the systolic blood pressure. And if you've ever seen an automatic blood pressure machine, then it's always the number at the top. And the systolic blood pressure tells you just how much force blood is being pumped around your body. And the second number, which is usually at the bottom, is known as a diastolic blood pressure, and this tells you just how much resistance the blood is having to travel through within your body. In the UK, the values associated with high blood pressure actually vary with age, and so I'm going to share that with you in a bit more depth. So, if you are under the age of 80 and you have a blood pressure from 140 over 90, or you have a blood pressure machine at home and the average is 135 over 85, then that would be considered as high blood pressure. And if you are over the age of 80 and you have a blood pressure reading from 150 over 90, or you've taken average readings at home and they've come to 145 over 85, then that would be considered as high blood pressure. There are two categories of high blood pressure that you need to be aware of. The first is primary high blood pressure, and the second is secondary high blood pressure. Now, in primary high blood pressure, this tends to make up 90% of the high blood pressure cases that we see, and unfortunately, in these instances, the cause of the high blood pressure is not known. Whereas in secondary hypertension, or high blood pressure I should say, this makes up the remaining 10% of cases, and in this instance the cause can be attributed to something such as the kidneys not working properly or issues with the endocrine system, which are responsible for releasing hormones, also known as messengers, around the body. There are many risk factors for high blood pressure, and I'll only just cover a few today. The first is if you are of Black African or Black Caribbean descent. The second is if you smoke or drink too much alcohol. The third is if you have a high salt intake within your diet. The fourth is if you have poor sleep. And the fifth is if you have a family history of high blood pressure. If your blood pressure is high, there are lifestyle changes that you can implement to help lower your blood pressure. The first one, which you can probably guess I'm going to say, is exercise. Try and exercise more frequently and more regularly. Now, I'm not asking you to climb the Mount Everest. I'm just asking that you increase the daily level of activity that you can do, and it can start small and then you can build on that and work your way up. So you could start by, for example, increasing the number of steps that you do in a day, or if you already go on walks, then you can try brisk walking as opposed to walking at a normal pace. If you have a pet, then you could increase the number of times that you walk your animal. If you like to jog, then you can jog 1 minute to 2 minutes longer and then increase it. Or if you're feeling super adventurous, then you can join your local gym and perhaps get a trainer or form a group that you can go to the gym with. The second thing that I'm going to touch on is diet. Aside from having a balanced diet and making sure that you're getting in your fruits, your vegetables, your protein, the one thing that I'm going to talk to you today is about salt. Now, if you're like me, then that means you love food when it's nice and seasoned. However, too much salt can increase blood pressure, and we want to make sure that our blood pressure is not high. So, one thing you need to bear in mind is the recommendation, and the recommendation is that an adult should not have more than 6 grams of salt in a day. Now, I'm not asking you to go about measuring how much salt you've placed in a meal, but I'm saying be a bit more mindful than you are now. Before you panic, I do have a tip for you. Whenever you purchase food, there is a label, and the label is color coded, with each colour telling you just how much sugar or salt, which we care about in this instance, is present in the food. Green means that it's at an all-time low, whereas red means that the level of salt found in the food is high. So when you are shopping and picking up items, pay close attention to the food label, as they will be your friend in this instance. The third thing that I'm going to touch on is smoking. If you are watching this video and are a current smoker, then I will encourage you to cut down on the number of cigarettes that you are smoking in a day. This is because smoking has such negative effects on the body, including on the blood vessels, and it can contribute to a blood pressure being higher than it should be. Now, if you would like to stop smoking or would like support in reducing the number of cigarettes that you are smoking in a day, there are loads of different smoking cessation programs that you can join. Your best bet is contacting your GP or local healthcare professional and asking them for advice on which ones are present in your local area. If you would like to purchase your own blood pressure machine, you can do so either online or in store. However, I do appreciate that the economy right now is very difficult and you may not have the funds needed to purchase your own blood pressure machine, but that does not mean that you cannot get your blood pressure measured. There are different places that offer blood pressure reading services, such as pharmacies, GPs, etc. So my advice would be to look at the options that are available to you in your local area. If you made it to the end of my video, you are a trooper, you are a star, and I appreciate you, so thank you so much. And I hope you found it helpful and learned something new. If you did, don't forget to like, comment and subscribe, but most importantly, share this with someone who needs to know what high blood pressure is. And I'll see you in my next video. Take care, Dr. Uyiosa.